Good day, everyone. You're welcome to yet another episode of the Yaba Voice webinar. It's always an exciting time when we reach out like this and you're able to join us in each of the episodes. We're glad that you're back to join us on this month's edition of the Yaba Voice webinar. And something exciting is the fact that the month of July is so dear to us in Yaba Voice because it's the 40th anniversary of the Yaba Voice. Though we started 4 years ago and it was like, oh, are we going to make it? And here we are, standing still strong and doing so very well. And so we're excited that you're able to join us on this episode again. And this episode promises to be exciting. So I hope you're good. And then again, yes, whatever times that we're going through, I hope you're keeping strong and then you're standing safe. To welcome us formally to this webinar is the medical director and is ready to welcome us. Over to you, Dr. Olubenga Adekile Oweye. You're welcome, sir.
Good morning, everyone. Good morning, everyone. I think I'm audible enough for you to hear.
Yes, sir. Yes, sir.
Yes. Okay, thank you. So good day, everyone, and thank you for being on this platform today. And I want to welcome you warmly to our regular webinar by Yaba Voice on mental health issues. As we all know, Yaba Voice is a platform for mental health education, advocacy, and community outreach. It is a platform of Federal Neuropsychiatric Hospital Yaba Lagos, through which the hospital creates awareness and educate the populace on topical mental health issues. Today's topic is mental health challenges of the elderly, causes and solutions. Mental health challenges of the elderly, causes and solutions. Older adults, those aged 60 and above, make important contributions to our society, either as family members, volunteers, or as active participants in the workforce. While most have good mental health, many older adults are at risk of developing mental disorders. They are also at risk of developing neurological disorders or substance use problems, as well as other health conditions, such as diabetes, hearing loss, or osteoarthritis. Furthermore, as people age, they are more likely to experience several conditions at the same time. Globally, the population is aging rapidly. According to World Health Organization, between year 2015 and 2050, the proportion of the world's population over 60 years will nearly double from 12% to 22%. Therefore, mental health and well-being of this category of people are very important. However, loneliness is commonly associated with old age. So also, they suffer some degree of mental disorders once they are above 60 years or 65 years of age. Therefore, in today's webinar, many questions will be answered. For example, who is an elderly? What are the peculiarities of this age group? What makes them prone to mental illnesses? What are the mental health challenges of the elderly? How do we prevent such mental health challenges? And for those who already have mental health issues, what are the available solutions, or how do they seek for the resolution of that condition? To do justice to today's topic, our seasoned expert in the house, I have with me this morning on the platform Dr. Taiwo Oduguwa, who is a consultant psychiatrist special grade 1 with over 25 years experience, and she is versatile in old age mental health. Dr. Taiwo Oduguwa obtained a Bachelor of Medicine, Bachelor of Surgery from the University of Ilorin and Fellowship of the West African College of Physicians in Psychiatry. She's also an alumnus of the Lagos Business School. She had a residency training at Federal Neuropsychiatric Hospital, Yaba, Lagos, and appointed as a consultant psychiatrist in the same hospital and rose through the ranks to become consultant special grade 1. Our area of specialization is geriatric or old age psychiatry. She has attended many trainings, both locally and internationally. She has also been involved in researches, both locally and internationally. Dr. Oduguwa is a mental health advocate, and she's passionate about service to God and humanity. She is happily married with children. Our second speaker for today is Akin Gabriel. Mr. Akin Gabriel is a licensed clinical psychologist with about 20 years experience in the field. Currently, he is an assistant director in the Department of Psychology, Federal Neuropsychiatric Hospital, Yaba, Lagos. He has passion to provide clients with individual and group therapy to help them facilitate social and personal adjustments to live a more meaningful and fulfilling life. Akin Gabriel had his first degree in psychology from the University of Nigeria, Nsukka, and a master's in clinical psychology from the University of Lagos. Presently, he is a doctoral student in clinical psychology at the University of Ibadan. As a clinical psychologist, his major area of emphasis is on psychological evaluation, psychotherapy, training, and development. Mr. Akin Gabriel is a mental health advocate and a public speaker. He loves traveling, poetry, and theater. He is also happily married with children. Ladies and gentlemen, I want to formally welcome you to today's webinar. And I want to implore you to kindly relax and listen to our mental health expert as we promise you a rewarding session of today's webinar. Over to you, Dr. Kemi Akitoyese.
Thank you so very much, Medical Director, for that arousing welcome. The MD had already told us what we are looking forward to during this webinar today. And I tell you, it promises to be really, really educational, not just because I'm saying it, but because you would be listening to seasoned experts who has so much information to share with you. But please note before we move on that we are also streaming live on Facebook. So if you cannot connect here, you know someone who can connect on Zoom but can join through the Facebook page, then please let them head over to Yaba Voice Worldwide. That's our Facebook page. And then they can also follow us as we go on this conversation for today. And so we're quickly moving 1 hour and then the time is running. All right, so Dr. Oduguwa, when we're talking about mental health issues, what are the common mental health issues that are faced by the elderly? Let's even start from there. Over to you, ma'am.
Okay, thank you very much, Madam Moderator. Good afternoon, my MD, sir. So before I would just like to give so according to the elderly are those who are 60 years. This age in United States and Japan, 5 years and above. organization further classified the between age 6 as the elderly age, 75 to 90 as the senior age. And having said that, let me go to your question. So with the elderly, I think first and foremost on this list will be depression, clinical depression. And you have like more than 1 in 10 of the elderly, coming down with this condition. Usually might be as a result of maybe loneliness, or poor health which they suffer, or losses, which they might have suffered over the years. Now, one can even add things like elderly abuse, as a cause of depression in the elderly. It's important to note that depression, clinical depression, is not the same thing as unhappiness. Now, you have other conditions like dementia, and this occurs, usually in the elderly, although we have cases that happen before the age of 60, which is called senile dementia. Now, dementia is a progressive, cognitive decline, which an individual suffers. And, it occurs in clear consciousness, and it's usually irreversible. And it's the memory problem that is the first thing that one will notice when, someone comes down, with this problem. So elderly also suffer things like sleep problems, and, the most common sleep problem in the elderly is insomnia. They are unable to initiate sleep, or they are unable to maintain, their sleep. Especially if whether the elderly have a lot of medications they take, and, some of these medications might make them wake up in the middle of the night, to use the bathroom. They also suffer things like anxiety disorder, where they have feelings of, deep worry, severe worry and fear. And, this affects or interferes with their daily activities of, living. It might be fear of, death, fear of dying, fear from poor health, which they suffer, or fear from memory problems. Now, this discussion will not be complete if we don't talk about delirium. Delirium is a medical emergency, which is commonly found in the elderly as well, especially patients who suffer from dementia. It's something that happens, abruptly. It happens within hours to days, okay? And, all of a sudden, someone who was otherwise stable, can now become restless or agitated. Some other people, rather than becoming restless or agitated, they become slowed down, okay? You find it also in patients that have, stroke, or elderly people that suffer, some severe infection like urinary tract infection, or things like dehydration, constipation, and so on. Now, also, we find sometimes that some of our elderly could have or could abuse substances. Some of them, carry it over from their younger age into old age, okay? And they suffer things like, or they take substances, like alcohol. They abuse substances like alcohol. Some of them even medicate, okay? They take things like sleeping pills, your Lexotan, your Valium, they abuse them, or they can abuse painkillers, and they can abuse things like laxatives. Last but not the least, elderly could have things that we call psychotic disorders. Many of them come down with psychotic disorders, especially when they suffer from sensory deprivation. When they have hearing loss, or eyesight problems with their eyesight, loss of vision, they tend to come down with psychotic symptoms. So these are some of the mental health issues, that we find in the elderly. Thank you.
Thank you so very much, Dr. Duga. When we were much younger, one of the things we were looking forward to is growing old, because you want to be able to take certain decisions and assert yourself. But now that I'm growing old, I don't want to grow old again. It's like I should go back, and I know it's not possible. But with what she had said today, now I don't know, it's looking scary out there. But maybe they won't be able to tell us how then we would not be able to also go through all of this, because this is the essence of the conversation today. If we would know the cause, then we would also know what are the preventive measures that we can put in place to safeguard ourselves. Because sometimes too, when you do not know, ignorance can make a lot of people to fall victim of all that she had mentioned. So we'll go on in this conversation, and Mr. Gabriel will be talking to us about these things that Dr. Dugo has mentioned. What are the causes? Let's know the causes so that maybe we'll also gain insight. Thank you so very much.
Thank you so very much, moderator. Yes, well, we shouldn't be scared. Aging is just a natural process that we all go through. In fact, it's a major prayer for some people so that they can actually go through the aging process. But yeah, well, what are some of the causes of issues in old age? Aging itself could actually be one of the process of aging itself is just one of those particular issues. Right from when the baby is born, the process has basically started. From the beginning to the end has already started. Yes, from the cells multiplication as the baby is growing, the cells are multiplying, all the organs are developing, baby is growing physically and in so many other ways. But a time will now come later in life when cell division will actually begin to slow down and eventually actually stop, much later. But the process, the issues begin to start as the person is growing, because from one age to the other, as the year go by and by, there will be certain changes as a result of aging that the person will be coming through. As unfortunately, some of these changes, mostly physical, will now begin to bring up some psychological issues within the individual. For example, we've heard about some of those changes, including things like hearing losses, maybe losing their sight, or some heart condition, some issues with the bone, some issues with reduced fertility, frailty, and all of those things will begin to come as part of the growing and aging process. I know what? People will react psychologically to some of these things, and they will actually cause quite a lot of things to them. So the aging process is actually one major issue that we have to actually deal with. Talk even about the issue of menopause, which is also part of it, and a big challenge to some to some women who actually undergo things. The issue with dementia that we have actually also heard about. So the aging process itself is actually one of the major issues that we'll go through. As we go along, we have to see that we need to also adapt and adjust to this process in order for us to actually age well. The other is to age well, and eventually, once we're able to age well, that is to be able to do some of these issues, we'll be able to actually have a good age. Now, what about other things? As we're also going, we're talking about aging now. It's not as if we just come suddenly and become old suddenly. As I said earlier, it will have started. So part of the issue that people actually have is actually the psychological adjustment to role changes, psychological adjustment to lifestyle changes right from birth. Role changes from a child to a teenage, to adolescent, to young adult, to mid-adult. These are major landmarks in one's life. The successful transitioning from one role to the other plays a big role in actually ensuring maybe the aging process is actually very good. Unfortunately, for some people, they have issues actually doing it due to maybe no fault of theirs. There could have been some issues with childhood experiences that are negative, some adverse childhood experiences, some traumatic experiences that they could have gone through that were not adequately managed, that will now constitute a major psychological issues that will affect the issue of aging. So that at the end of the year, at the end of the day, when they've come to the particular age, they look back, oh, what a pity. How did I find myself here? It will also be, on the other hand, it will also be a look back that will just be, oh, thank God, I've not done so badly. So there are so many other things. For example, there are so many, there are some situations, what's called the psychosocial, story by a particular person called Eric Erickson, a psychologist, who actually talked about it, that we all will come to a particular age and time when we now look back and we either clap for ourselves or maybe actually go back and despair. So the successful maneuvering of those stages actually constitute a major aspect of issues constituting into lifestyles, issue difficulties with aging. Another major one, of course, is relationship. Has to do with relationship. Apart from the individual, we all people oriented. We should be people oriented. We don't want to be alone. We relate with individuals. Some will get married. Some move on to other relationships and be together. But eventually, too, as we move on, the nest will begin to empty gradually. Of course, we know about the empty nest syndrome. when the children begin to go their own ways, they begin to either go to school, can start with school, boarding school, for example, or maybe they go to the university, or eventually they get married and they begin to leave the home. It gets worse, especially when a spouse now dies and the person feels lonely. The emptiness syndrome is a massive amount of issue that most aged actually find. There's a new one that people actually call the Japa syndrome now, which is also related. The Japa syndrome, of course, that we know it when quite a lot of Nigerians are leaving the country and going to other country for better opportunities. No, leave the parents, leave the aged individual alone, and you also begin to feel. These are some of the new things that we are related with that are constituting issue in the age. There's so many other things. Grieving too. When the partner goes, grieving is grieving properly done, because there are processes, as we also see later, of grieving as going on. So these are some of the issues or causes that will affect, bring up lifestyle issues amongst the age.
Thank you so very much. But you know, one thing that you said that, caught my attention, and that was the fact that you said role change. Sometimes we are not prepared for this transition at all. We just want to do landmark birthdays. But what are the things associated with these things? Sometimes we are not in any way prepared for it. And if you're not, or if you have not been, transitioning very well, right from adolescence and other things, there might be a problem in adulthood. I hope you're taking notes so that we'll be able to get a lot of information that will help us to be able to cope and function very well. So Dr. Dugwa is going to tell us about what are the common symptoms that we'll see in elderly, because sometimes we tend to tag them. We tag them as being witches, wizards. Some people don't even want to interact with them. So what are the symptoms? What are the signs that we'll see with these people that will make us know that, oh, this is the mental illness, and then we can get help for them as soon as possible? Over to you, ma'am.
Okay, thank you very much for that question. So, the kind of things we see will depend on, the condition which they suffer. So, for example, those that have depression, depression, is different from unhappiness. Depression is such that the individual has low mood most of the day, nearly every day, for at least 2 weeks. Okay? So there's associated, low energy, and there's associated low drive. There's also lack of, interest in activities they previously enjoyed doing before. For example, elderly that, enjoy going for social activities or participating in religious activities, they no longer have interest in doing such. A lot of times, the elderly complain of physical symptoms. For example, headaches, body pain, crawling sensations and things like that. And you find out they go to their GP, to complain. Now and again, they do tests, they treat them, but they still don't get better. Such individuals, they need to be looked at closely because they might have, depression. So they also have changes in their personal hygiene. They don't tend to themselves because of the low energy and low drive. Sometimes they involve themselves in substance abuse. Most of the time trying to medicate, the distressing feelings they have. They could find themselves taking sleeping pills or alcohol and so on. Now, sometimes when it gets worse, the elderly could have feelings of hopelessness, worthlessness, and helplessness, especially when they don't grieve properly, and this forms like the prelude, before them having suicidal thoughts or suicidal ideation. Sometimes they end up killing themselves, and sometimes they end up, getting over, that feeling. So by and large, those are some of the symptoms, of depression. Now, for people who suffer dementia, what are the kind of things you see in, people who suffer dementia? Dementia is a very devastating condition. It's kind of condition that you see your loved one going down, deteriorating, and you can't do anything about it. As I tell folks sometimes that it's like the individual dies twice. The first death is that the individual loses his or her personality. They eventually become a shell of themselves. They lose all the substance in them and become a shell of themselves. That's the first death. And the second death, is the physical death. Now, having said that, what are the things we see in patients who have dementia? One of the first symptoms that you see in patients who have dementia is misplacing their items. You see that now and again, they misplace their wallet, or misplace their money, or misplace their glasses or their keys. And, it's the caregivers that they tend to accuse, of stealing their things and so on and so forth. Now, so they also forget recent events. Someone came yesterday, someone said this, and say, no, nobody came yesterday. Difficulty finding words, which they want to say. They know what they want to say, but they can't remember, what the right word is. Sometimes they get confused, maybe within the house, they might miss their way around the house. Or sometimes they go out and are not able to trace their way back home. Okay? Sometimes they have difficulty, simple everyday tasks and all that. And because of these symptoms, they tend to, become a little bit withdrawn, to themselves. As the disease progresses, there's increased trouble remembering things, and they become more confused. One thing that's striking about them is that you find them asking the same question over and over and over again. Even though you're giving them responses to that question, you ask the question again, keep asking the question and keep asking the question. And this can be very, very troublesome, especially to the caregivers. Okay? Now, as the dementia, gets complicated, they tend to lose track of, time and place. They don't remember the day, or they might not remember the month, and so on. And they begin to forget the names of close family members and friends. Now, sometimes some of them become combative. They become difficult to manage. The paranoia, the paranoid feelings they have might deepen. The confusion might deepen. They become restless. They have poor sleeping pattern. And this is at the stage in which we find them reported to the hospital at Yaba. And they're in their homes, so they say, I want to go home. I want to go to my house. I want to go to my house. Keep saying that. Some of them will even pack from load and say they are going home. They are going home. And you find out a lot of them at this stage, they might wander away. And that's why we don't allow patients, or we advise that patients who live with dementia should not live alone. There should be somebody with them, because they can wander away and not be able to find their way back. Okay? So even the activities of daily living, they might need people, to help them, to care for them, in some way, maybe choose their clothing for them or help them to brush their teeth, at this stage. So later on, in the course of the dementia, they become more dependent on people. They cannot do things by themselves. Their vocabulary has more or less, it has dwindled, They can say monosyllables, but they can't sustain a discussion. And they are not aware of the environment. They are not aware of people. They can't recognize their children anymore. They are more frail, They can't walk by themselves. And sometimes they can't even eat. They can't eat by themselves, really. They have to be fed. And they lose bowel control. They lose, bladder control. They have to be on diapers. They are more prone to infection. When they eat, they are unable to coordinate, their chewing and swallowing reflex. They are unable to coordinate. And sometimes they find the food goes to the wrong place. It goes to the airway rather than going to the GI tract. And this, can make them more susceptible, to pneumonia. A lot of them at the end of the day, die from, infection, from pneumonia.
Thank you so very much, Dr. Otugwa. Something she said that struck me. She said a lot of things, beautiful things, and it struck me the fact that it's like dying twice. You're alive, but basically you're not in tune with your realities anymore. I can't imagine my dad not knowing me. I don't know what he's going to do to me. It's even messing with me thinking about it. I don't want to even go there. But maybe Dr. Akin Gabriel was going to share with us what's the psychological effect of aging on family members, so that maybe you will be able to help people like me, because I don't even want to go there. Over to you, Dr. Akin Gabriel.
Thank you so much. Help people like you, help people like me. Aging gracefully, aging dreadfully. What are some of the psychological effects? And most of the psychological effects, of course, At times, they're actually reactions to the physical signs or effects of aging. You can see there will be psychological consequences of the physical condition, of the physical signs. And at times, psychological states too could actually lead to some physical condition, like that. So Dr. Duga has actually mentioned some issues with some of those physical conditions, but they go on so much. What are some of those psychological reactions, some of the psychological effects? And it could actually start, these psychological effects and reactions usually determine or they are shown in the way we all react to try and maybe, for some of us, to try and maybe cover up the aging process right from the first time maybe a person first notices a gray hair on his or her head. They say, is either a scream or a clap. I remember Professor Wolin Shoyinka, one of his major, famous poem was that to my first gray hair. He celebrated his first gray hair. For some people, it's dreadful. It's like a scream. Why? I'm growing old, and they begin to now panic and react and do all that kind of thing. So these are some of the things: fear, anxiety, a lot of anger, and some panic. People who actually go into panic because when they begin to see the signs, of this, when people begin to see signs of wrinkle and all that kind of thing. And that's why we now see modern day, you go to any shop or maybe a street corner, you see some people selling stuff like hair dye, like all form of makeup and everything. People patronizing them so much and spending hours dyeing off their hair to just try and fear. Could it be? But really, what's the reaction to all of these things? It's a form of despair. It's a form of trauma. For a lot of us, for a lot of people, they want to deny the process. There's actually a process involved, a denial. There's some form of defense about it. No, it's not possible. I'm not going. Oh, it's not possible. I'm just 32. I'm just 41. It's not possible. That kind of a thing. I'm beginning to deny and do all sort of thing. And some people can actually be in that denial, trying to ignore the signs, and they still go on as if they are teenagers. They're still wearing their shorts. They're still wearing the hairstyle that they used to wear and all that kind of thing. When it has now come to a level that they can't deny it anymore, that is so obvious, maybe because of certain very obvious physical condition, anger could actually come up. People get angry, see them becoming irritable because perhaps there's nothing they can do about that. Now, of course, there's a level of bargaining. What can I do about this? People go for Botox, BBL, all that kind of a thing, as well as some other form of surgery, just to preserve their looks, to preserve the way they feel, and all that kind of thing, to present themselves in a way. It's almost as if being ashamed of their old age or the signs that they're actually seeing. And from there, so many other things, they can eventually go into depression. Dr. Duga has mentioned what depression really is. They become so unhappy when the reality is real rich that there's nothing at this stage. I'm growing old. There's nothing I can do about it. When the teeth begin to fall off, when the hair begins to fall off, when we decide begin to talk about later that a successful maneuver from to the aging procedure is actually the acceptance from the first moment it starts. From the first moment we notice the gray hair, we need to accept that this is a natural process that everybody will go through, and they will eventually maybe arrive at. So these are some of the psychological effects that we have in individual in aging. Thank you.
Thank you so very much. I recall the first day I saw a strand of gray hair. I screamed. I screamed. It was like they have told me that I'm old. And they have just confirmed something on me. I screamed. I snapped it. I sent it to my family platform. My brother said, I have plenty on my head. I said, hey, and I'm older than you. Oh God, it was like, I just want to be like this. I don't even want to think about it. But really, one of the things that he had said is the fact that a whole lot of times we tend to deny. And when we deny, and then we are now faced or boxed into the reality corner, it could bring on a lot of emotional reactions. We could now even trigger the whole process of what we're talking about today. Please note that you can send your comments and your questions to the chat box. Our guest speakers will are ready to answer. So anything on this conversation of today, please send to the chat box, and then we would talk about it with you before the end of the section. So please send your comments. Now let's look at, for people who have had mental health issues, or who are having to deal with mental health issues, struggling with mental health issues, and who are elderly. So, Tuko, what can we do? How can we help them? How can we deal with the issue of mental health issues in the elderly? Over to you, ma'am.
Okay, thank you so much for that question. And this question not only speaks to the elderly, I believe that, it should speak to even the younger age group, because everything in medicine is about prevention, so that at the end of the day, we enjoy a good life and all that. So we are going to look at this holistically, okay? So what do we do when things like this come up? So I'll start, in the light of primary prevention. In the first place, primary prevention, that's the best way to start. So this is about health promotion, maintaining a healthy lifestyle. We eat healthy meals, have healthy choices, regular exercises, avoid smoking and avoid alcohol, then, go for your regular medical checkups. A lot of us, especially those of us in the health field, we take these things for granted. What are our numbers? What's your BP? What's your blood sugar? What's your cholesterol level? So regular checkups, are very important. Now, it's not only about that, we also talk about our social context. I remember when I started working in this hospital, we went for an orientation program, and they said that that was on day one of work years ago. They said you have to do PP. I was like, what is PP? How can they be telling us we have to do PP when I'm starting work today? I thought it was private practice. No. Pension plan. What's your pension plan? So your retirement plan, what do you plan to do after retirement? And it's not about, just about money, but the activities, you have lined up that you do, after retirement, because retirement is just at 60, which is still relatively young. Okay? So prepare for retirement, nurture relationships, have good relationship with your family members, with your spouse, with your children, with community members and so on. Build your social network so that when you get to old age, you have people to call and people to talk to, because loneliness is a reality in old age. Now, so that's talking at the individual level. At the family level as well, the children have a role to play. Relatives have a role to play. Don't abandon your parents. Even if you don't really have the finances to take care of them, care for them. Don't leave them to the care of strangers in the name of, carers or house helps. Care for your parents, visit them regularly, reach out to them regularly. Also, the government has a role to play in this health promotion. Those that are retired, they should improve their retirement package, and let them collect their retirement benefits seamlessly. They don't have to join queues and all that. And also, improve the infrastructure that are available for the elderly. Healthcare. A lot of elderly people cannot afford healthcare. The cost of drugs are so prohibitive these days. I wonder how they are coping. So if the government can look into that for the elderly, it will really go a long way in helping them. Now, at the secondary level, secondary prevention, what should happen? So when you notice the symptoms, okay, when people notice symptoms of health problems, they should report early to the hospitals, okay, where appropriate medications will be given to them, okay? So for example, those people that have, depression, they'll be given antidepressants. Those that have psychotic illnesses will be given antipsychotics, even the talk therapy, what we call psychotherapy, will go a long way in relieving their symptoms, where they'll be given supportive therapy, where they'll be put through cognitive behavioral therapy and so on and so forth. Okay? So at this point, it's very important to note that there's no cure for dementia. There's no cure for, as we speak, there's no cure for dementia. However, there are clinical trials going on, all over the world to, improve the treatments we have on ground for dementia. Now, However, what we do in the hospital here is that we manage the symptoms, okay? We manage the symptoms in such a way that we allow for a gradual decline. We don't, if we don't treat, the decline will be very abrupt or to be fast. But here we manage the decline, of the illness. Then we try and take care, of the behavioral problems which, the patients might come up with. So that's, with regards to secondary prevention. So tertiary prevention, that has to do with rehabilitation, of, the affected individual. We try to reintegrate them back, into the society, okay? And we try and make, prevent relapses in them. Now, so integrating them back into the society, a lot of elderly people will need someone to care for them. They will need carers, So these carers could be formal or informal caregivers, okay? So the carers can come, to their homes and take care of them. Now, care homes or nursing homes or old people's homes, we're having more and more of them. So for those that they find that their children are all living abroad, it's an option. They can send their parents, to these care homes or nursing homes. That is our reality. I know back then in those days, it was a taboo to send your parents to old people's home. But that's the reality, and that's where we find ourselves today. So, we'll try and make life easy for them, whatever aids they need, like the walking aids, hearing aids, glasses, we try and provide for them. Even the occupational therapy has a role to play, So especially for those at home that don't have anything to do, they just sit down at home doing nothing, the occupational therapy can create a structure, for the elderly, create activities for them to, do, daily, day in, day out. Now, it's incomplete not to talk about taking care of the finances of the elderly, especially those that suffer dementia. At the tail end of, patients having dementia, they don't know what to do again. They don't know how to do anything. So you might need to, start the process of, getting the power of attorney, which their, next of kin can be involved in. This is just to transfer, the running of the affected patient's finances to somebody else to run for them, so that they can use that money to take care of the affected individual. So these are things one can put in place to help to rehabilitate, patients that have mental health issues, especially dementia. Thank you.
Thank you so very much, ma'am. Dr. Otuko had listed out quite an array of things in terms of what can be done. And when she was talking, something that happened over the weekend came to mind when I was at a function, and there was this elderly woman who they wanted her to snap with her daughter who was celebrating her birthday. And they wanted to help her. And she said, no, she insisted. And I was saying that sometimes some of these, our elderly can also be very, I don't know what they want to use, but they will refuse help. And so the guy is still going to come back and tell us, how can we? Because sometimes they don't want this help that you want to provide for them. They say, I can do it myself. Leave me alone. I can do it myself. And it can also be really, really frustrating, even for the carers and other things like that. How can we also help them? And other things like that, we'll look at them. Mr. Gabriel will be talking to us now that we are going into, maybe I'm coming to terms with that reality. We are going into the stage of the elderly. What can we do? How can we? Prevention is key. We know that. But what can we do? What do you think we can do to help us? Because I don't want all of these things. All right, over to you, sir.
Thank you very much. That's grandma that you just mentioned. Sounds like somebody that is adjusting gracefully well into that age. That's what we mentioned, the issue of aging gracefully and not aging dreadfully. Of course, the first point there, of course, is acceptance. We need to accept the fact that aging is part of life. It's just a part of the growth process. Just like it's sure that we will grow from toddlerhood to a child, to teenage, to adolescence, eventually we also get to an old age with all the attendant signs. the most important thing on how to stay healthy is acceptance. We mentioned earlier about the issue of reaction. Most of the time, most of the psychological issues that are associated with aging are as a result of the struggle against the natural process of aging. But if you're able to now accept the fact that, okay, these signs will come, a stage will come when certain things will begin to, that will begin to manifest physically as well as well. Not only physical changes also, there will also be changes. There'll be social changes. There'll be psychological changes. Social change in terms of the roles that will be expected of the individual. The roles expectation of a 21-year-old is different from that of a 15-year-old thereabout. Each person has his own role. And by the time an adult is about 60 years old, which we are taking as our own age at this time, there are also certain expectations, that we expect to move into in terms of responsibility within the neighborhood, in your religious society, within the family, in some communities. It is people at this particular age that they're even giving some official recognition in terms of maybe some chieftaincy title that means quite a lot of playing certain roles in terms of decision making within the community or within the family. It was only going to be at that particular age. Also, some psychological expectation as well in terms of expected behavior, expected relationship, and the things that we do. We should, so it's the acceptance of that fact that will make a person to transition gracefully into aging. So that apart from that, and apart from maintaining a good diet, healthy exercise, and all that thing that we're supposed to do, there are so many other things. Another major thing about aging, of course, is that the chief work of the aged when they get into that role now becomes not only work as you see it, because in this age, work takes a different definition. Because an individual has retired doesn't necessarily mean is no longer able to work. What the nature and the type of work will just differ. And he or she should actually be prepared to be able to go into that role. What are some of these roles? Some of these roles, work will mean actually taking care of the younger generation. At this age, it's the grandmas, the grandpas, who are the custodian of the customs, as well as the other roles and laws and practices of the society. They can pass down. But if they are neglected, if they are not meant to be a part of this thing, they can actually feel neglected. They can feel abandoned and unhappy. But if they are brought actually into decision making within the community, they can still make decisions. They can still do quite a lot of things within the community. They still have influence. Even in the country, I was just going through a list of the richest people in the country. The top 5 are actually people over 60. So they can still make contributions, not only financially, but also in terms of the advice they can give, in terms of counsel, and sort of experience that they bring into fore within that particular area. So one of the areas of actually staying healthy is the ability to be able to perform these expected roles and not to be abandoned, not to run away, not to shy away from this kind of thing. Is to live a healthy life, is to interact with family, is to keep the family network, is to be able to engage. Part of the way of staying healthy is to be able to relate with members of the community and play an important role that can actually move that community or the family forward. I said also one of the things again that they can do, they can do the work, they can work, they can still do so many other things that that the community can still call upon them to do and make that particular role. So these are some of the ways of actually staying healthy. Other areas have actually been mentioned in terms of healthy diet as well as exercises I've mentioned earlier.
Okay, so I'm going back to the gym because we must stay healthy. This healthy is a must for all of us. So healthy diet, healthy living, and other things. So we have some questions on the chat box. We'll quickly address them. Dr. Ojukwu, what are the actual causes of dementia? As I have seen old person and a young doctor with dementia. Can you just take that in just 1 minute?
Okay, so thank you very much. There are different causes of dementia. And the most common, form of dementia is the Alzheimer's dementia, but this usually occurs in the elderly. So there are some things that can cause, dementia, which has to do with our lifestyle choices. For example, people who have stroke. No stroke emanates from high BP, uncontrolled, high blood pressure. They can come down with dementia later. Or people who have, bad diabetes, metabolic, diseases like diabetes, hypertension, they can come down with dementia. There's what we call, the normal pressure hydrocephalus. This also, although it's a reversible cause of dementia, it can cause dementia. Alcohol, alcohol, chronic drinking of alcohol can also lead to dementia. Even trauma, head trauma, can affect even a space when there's a tumor. There's a space, there's a lesion in the brain. It occupies space. The pressure it creates, can eventually lead to dementia. Even things like HIV, HIV can lead to dementia.
Thank you so very much, Ma. There's another question, Mr. Gabriel. I wanted to take this on. My question is one of balance. How do you recommend balancing your own personal and family needs with the growing needs of the older family member while still maintaining your own responsibilities and interests? How can we balance? How can we juggle? Somebody also asked something similar, having a child and also taking care of the elderly. How do you balance that?
Roles are responsibility. I think that's what we're talking about here. If at every stage of life we have role, each person has role to play. And how do we balance that? We plan. We factor the time that we spend for ourselves, and we know nobody is an island unto himself. Nobody is, as we are, all the functioning that we have, all about maybe about 5 functioning, relating with other and being able to manage our relationship is one major part of it, and responsibilities. The aged grandma is also part of responsibility that will also be actually put into can I say a program that we have put on for ourselves to take care of ourselves, just like we are taking care of ourselves to take care of the children, spouse, as well as other members of family that are there. So the right time needs to be assigned to the right task concerning this. They need care. The same way we will care for children who are young, who are unable to take care of themselves. It's also the same way we apportion time to take care of the elderly. So if there's child care, there's also the elderly care. So if there's also child abuse, there's also maybe elderly abuse. In elder abuse in this particular case. So we need to actually find time, create time, actually deliberately to take care of our elderly.
Thank you so very much, Mr. Gabriel, for that answer. Dr. Dugwa, this person wants to know whether arthritis in elderly could be cured.
Well, I'm not an orthopedic surgeon, but it depends on the stage of the arthritis. If it's a mild arthritis, I believe it can be cured. But there are some arthritis that, they are so chronic and painful and debilitating that, surgery, will be the answer for a knee replacement surgery. And I believe that's the cure. At least, and usually folks that do that surgery, their knees are okay for the next 8 to 10 years. They don't have any problems, So I guess that's, part of how that can be managed. The surgery is usually the last option anyway. And that would depend on the ability, of the affected individual to withstand, surgery.
That's also very important. Mr. King Gabriel, earlier you were talking about if there is child abuse, there could also be elder abuse or something like that. But somebody is asking here, our mama, Dr. Ogun, is saying one of the challenges of the elderly is the abuse of the elderly, which is common. Can you quickly talk about this in 1 minute?
Oh yeah, this is a much often neglected area because they believe that they are adults. They can be abused, but they can definitely be abused. They can be taken advantage of. They can be swindled. They can be physically abused in so many ways, which we have seen. The carer or the caregiver, who could be a child or a relative or anything, will actually vent their own emotion onto this elderly that we're talking about. Just the same way that they could do with children. They could steal their money. They could convert their properties. They could do all sorts of things. One way you should know that once the elderly, an elderly person has gone to that level and begin to see some mental health issue, they have become vulnerable and need to be protected and assisted onto passage. Thank you very much.
Thank you so very much, Mr. King Gabriel, for that. Somebody responded to what I said earlier, that they view help as weakness, and that is why they resist receiving help. Yes, but I think one of the things that they need to come to terms with is the fact that that is their reality at this point in time, and so acceptance of help is also a sign of strength, not even a show of weakness. In any way. Kelvin, your question has been answered, which is that you have to create time for each of them. There is no one that is superior. Every individual, the children, the elderly, has different needs. And so just create time, and then you will be able to juggle that while you still maintain your own health. It's important that you do not let go of yourself at that point in time. Dr. Dugua, quickly, what causes the elderly to soil their body? Is there a specific cause? Over to you, ma'am.
Thank you for that question, Madam Moderator. But please, let me just add something to what Mr. Akin Gabriel said about the elderly abuse. So elderly abuse can either occur by commission, physically abusing them, stealing their money and so on and so forth, or omission, being neglectful of your elderly. Not giving them food, not giving them their medications, not taking care of their, hygiene and so on and so forth. I just thought I should add that bit to it. And this is really on the rise, at the moment. So going to your question, you asked what was the question again?
Why do they soil their body, the elderly?
Okay, so
is there a specific cause?
Yes, so dementia has to do with the brain function. The brain in itself is reducing. The brain size is reducing. Of course, when the brain size is reducing, the function, what it can do, will reduce. So the places that in the brain that control their bladder, and their bowels, the control of being able to hold your urine or hold your, feces, that function will disappear with time. Hence, they will soil themselves, involuntarily, not voluntarily. Thank you.
Thank you so very much. Mr. King Gabriel, how do we take care of a blind elderly mother, especially when we go to work, having only male house help in the house? How can we help those persons?
There are several ways of actually doing that. I think the most important thing here is that this person is actually even interested in caring, and they'll actually be able to get someone. Get professional help for this person. There are health assistants that could actually take up that role in your absence, in as much as it's not just them, your own presence there, your time spending with that person. Remember that this person can't actually see. You can't see you have become like their own eyes. You can still spend quality time with them. So you help them by being there for them, meet their needs, at that particular time. And if you have to go to work, because you might also need to go to work in order to be able to provide for them, you get qualified assistants to help take care of them.
All right, thank you so very much. And to ensure that things are done properly, now people have CCTVs installed in their houses, so at least you can be sure that they are properly taken care of. Thank you, Olukemi, for saying aluminium has been found to be a suspect in dementia and other things like that. This dementia is raising a lot of issues. Dr. Dugwa, there are so many questions about dementia. This is common. How can we prevent it? Now, I think people just need, is there something to do to prevent dementia? Dr. Dugwa.
Those that will have it. Dementia can be sporadic. And age, is the number one risk factor. So the older one gets, the more likely they are at risk to develop dementia. However, there are some lifestyle, as I said earlier, there are some lifestyle, things that we can do to prevent it. We exercise regularly, we eat right, We watch things that can cause excessive cholesterol in our blood. Our blood sugar, we are wary of it. Our blood pressure, we are wary of it. So there are a lot of things. Alcohol, you avoid it as much as possible. Even smoking, all the bad stuff, what avoid them, and you do the healthy things. That will go a long way, in preventing dementia. You sleep well. Sleep, the sleep deprivation has been another thing that has been implicated in people having dementia. Chronic sleep deprivation over the years, it's also has been implicated in people having dementia.
Thank you so very much. Mr. Gabriel, can people have old people home or places where they can care for them? Is it appropriate to have an old person's home or to care for them in our home? Is it proper?
Well, I remember a particular scenario a few years ago when a younger generation gathering, and some of the discussion there was talking about the attitude towards schooling away from home, like in boarding school. And somebody mentioned that our children put us in boarding school, they take us away from home. When we grow up we put them in a school. So which ones are actually appropriate? I guess it depends. The whole people's home, I want to believe, is a professional institution where professional care can be given if the individual requires to be institutionalized. Perhaps maybe there are no family members around, or maybe or time will not be spent. It could actually be put in a whole people's home. So which one is better? Of course, home is always better for everybody, as long as you have the right people around, you have care there, you have people who can show love and care. Well, of course, we all know, especially in large cities, this may not be the case all the time, and you might actually need to put the person somewhere where you are sure that you are receiving premium care and you visit regularly to actually take care of them, because the condition, the complication might be so much that may actually need to be under professional care.
Thank you so very much. So that it's not out of place if you can manage them at home, but then if they need more care that you can provide, then get them the help that they need. Okay, so Dr. Dugo, there are questions about dementia, paranoia, hallucinations, seeing things that no other person is seeing and other things. So can you just quickly talk about that in 1 minute, ma'am?
Okay, so this occurs, at the later stages of dementia, as I said earlier, and these are part of the symptoms, signs and symptoms that we manage in the hospital. So what we simply do is that, we give them what we call antipsychotics. This will tend to calm them down and, make the hallucinations or illusions or whatever disappear. Okay. In some, elderly, it's difficult to treat them because sometimes they react to the medications. So we are a little bit wary about the dosing. But pretty much these medications help to take care of those hallucinations and illusions of what's happening.
Thank you, ma'am. This is how far we can go today. I'm just going to take last comments from our speakers. We have addressed questions about how to prevent and avoid dementia. And I think Dr. Dugwa is, we don't take comments on this platform. Just send your comments in, and if I can, I will be able to take it for everyone who had commented that they had gained a lot from this webinar. Thank you so very much. We appreciate your presence here. And what we would love that you do is be the vanguard. So share this. The recordings of this webinar will be on the YouTube page. You can share this with everyone around you so that they can be better informed. When people are informed, they are empowered, and then they can function better. But when information is missing or lacking, then people are lost and they may not be able to function as well as they should. So please be the vanguard, help us to share this information with everyone around you. So we're going to take a last word. Dr. Dugoa, your last word, ma'am.
What I would say is that, the elderly are very important parts of the society and the community. And we should not neglect them or stigmatize them, because I see that being done a lot. And this speaks to everybody, at the different levels, of the society, at the family level, at the community level, and at the government level. Okay? We need to do whatever we can do to help them so that we can help to preserve their dignity, and help improve, their overall quality of life.
Thank you so very much, Mr. King Gabriel. Your last word.
Okay, thank you. No doubt about that. Adulthood of aging, old age is something that all of us will get to. We can choose to age gracefully and not age dreadfully by accepting the reality. Thank you.
All right, so I'm going away from this webinar. I'm going to age gracefully and not judgefully. No fear again. All right, Jacinta, yes, we have addressed this issue about calling out our elder ones witches and witchcraft or wizard or whatever it is. We have addressed them. Sometimes they have odd behavior, but again, we know what the symptoms are, and so you can get help for them. The best thing is to identify as quickly as possible and get help for them. And then please note that you can control quite a whole lot of things. You can determine how the trend is going to be for you. All that you need to be is get involved with yourself. I'm not saying get involved with other people now. Get involved with yourself by managing your mental health, prioritizing the things that are important, and ensuring that you stay active. When you do all of these things, you're ensuring that you give yourself a greater percentage to live the best of life. Like I said earlier, the recording of this webinar will be on the YouTube page. You can go back, reassess, listen again, and then you can also share with people. Next month, by the third Thursday of the month, we trust God to keep us alive and to bring us again. And then we'll be looking at social media addiction among adolescents and young adults. And then we're looking at the way forward. How can we deal with this? How can we help people to get out of this problem? Until we come your way again, I want to say thank you so very much for being on this call with us. Please remember, this is our 4th year anniversary, so you're free to go to our YouTube page or even the Facebook page and say congratulations to us. We had indeed come a long way. So thank you so very much, everyone, for being on this call. Stay safe, take care of yourself. On behalf of the medical director, Dr. Olubengadekile, and every member of the Yaba Voice team, we'll say thank you for being on this call today. Thank you. Bye-bye. Take care of yourself.
Bye. Thank you.
Well done.